Maybe you probably can't speak to it on a national level, maybe a local level, but do you feel like are our funding priorities in place, or is politics also the kind of red tape bureaucracy is also kind of causing rifts there too, in terms of where to allocate the funds in order to be able to better respond to these emergency situations?
Funding is always an issue, and as money gets tighter, budgets get tighter. Localities have to look at where their priorities are. Part of the issue is that in many cases, law enforcement is seen absolutely as an essential service. Most folks would view fire service as an essential service. There are a number of states still in this country that do not consider EMS an essential service.
How is that possible?
That's a good question. I don't know how you can consider that to not be an essential service. And when I say that, I say that that's how their funding is reflected. Law enforcement has a lot of opportunities, drug seizure money, forfeitures, and that type of thing. The fire service doesn't have that same opportunity. Now there is federal funding. There are a number of grant programs for staffing and equipment and that type of thing. And for EMS, though, you just really don't see that same level of support. And in many cases, especially when we look at the opioid crisis, there's a lot of funding going to law enforcement and not much funding going to EMS. And EMS are the ones really at the tip of that spear because we're treating the patients of opioid overdoses, and we're treating those folks who have tried drugs for the first time and had an adverse reaction.